It started out as a dream pregnancy and then turned to absolute chaos. I started noticing some shortness of breath. I showed up for a routine visit with my OB, and I had to use a walker. It was a very short visit. She knew something wasn't right. My husband dropped me off at triage, and I just thought, okay, we're gonna figure out what's going on, and I'll be home shortly. The doctor came in. She was with the maternal fetal medicine group. She held my hand and told me that they found a mass, and it is a tumor, leiomyosarcoma.
A leiomyosarcoma is a malignant tumor of the connective tissue, typically arising from the wall of a blood vessel.
And I'll never forget, it was very point blank and said, this is life or death.
A sarcoma is one of those tumors that you want to get it out.
Hers was unusual because it was also behind the liver. And in addition to the tumor itself, there was a clot that was extending all the way up into her heart. I remember vividly getting a call from one of my colleagues. There's a young woman who's in her third term of pregnancy who has this unusual tumor, but we don't think there's anything that we can do. And I remember looking at the imaging and thinking, I think technically this is something that we could tackle with all the right people.
So I helped build this team of experts from the people in this institution who I know are the best at what they do.
The longer they could hold off on surgery, it allowed Julia to continue to develop.
We needed to balance that against the tumor progressing and causing a major catastrophic incident. Every day mattered.
She was ready to fight. She was ready to do whatever it took.
As they were taking Jessica back to do her C-section, and they asked me, "Are you sure you want to do this?" I remember telling them, "Deliver that baby. We are going to pull her through this operation."
So right at 31 weeks, she was born. She was remarkably healthy.
Ultimately, her C-section went very well, but there was still a lot of uncertainty moving forward.
And there was progression of this tumor by a few centimeters. So that is a very quick growth within a short period of time.
We were told to make arrangements just in case it did not go well. And I finally just said, listen, I love you, I love the kids, and just always share positive stories about me. And
one of my goals as a cancer surgeon is to try to push the envelope. Surgery was the best chance.
You know, frankly, this was her only hope of cure.
You know, because of the large size of her tumor invading both her vena cava, her liver, and into her heart, it required a multidisciplinary team.
Once we had a plan in place, I think everyone just stepped in and did their job flawlessly.
This is a massive tumor. I start opening the abdomen, mobilize the liver, detach the liver from the inferior vena cava.
So my role in the surgery was basically to remove that part of the inferior vena cava that had the tumor itself, and then replace it with a new plastic tubing.
My role in the procedure was to open up her right atrium and then help deliver the tumor down into the abdomen so it could be safely removed.
Then it's replacing everything into its normal, correct anatomic space and sewing her up. I think it went just about as well as it could have gone.
It's a little over a year later, and she's doing really well.
I think it's a great honor to be part of a system like Northwestern Medicine where multiple experts can get together and provide the level of care to a patient like her.
There's really only probably a handful of places that would have taken on a case like this.
It was the right place at the right time. Julia is healthy, happy, 1-year-old, and I feel wonderful.
I just want to remember a quote from St. Francis of Assisi that said, "You start doing what is necessary, then you do what is possible, then suddenly you are doing the impossible." This is what happened at Northwestern.